Kashmir Valley in particular. Registrar of the University, Nasir Iqbal Saab, Dean Research, Professor Muhammad Sultan Bhatt Saab, and most importantly, Manzoor Saab, who is organizing perhaps the fourth or fifth event on this very important topic, which is very close to my heart. And I must also mention here that the Vice Chancellor Madam has been pushing this particular very important social theme as well as a theme for the health department and also very important problem specifically in Jammu and Kashmir, which needs an urgent solution. I feel that a university with a strength of 17,000 students and multiple campuses and with such a large faculty, I think the message of awareness regarding breast cancer and this 3-day research program will not only go to 17,000 houses, but maybe several thousand people across the state. And I think therefore the Kashmir University is a very good platform for such an important cause. Whenever a family is impacted by this disease, and I have personal experience in my extended family, it is very devastating. And most importantly, as we realize that it not only impacts the family for a short time, but for a very long period of time. At the national level, the broader research indicates that there is almost 27% of incidence of this disease in newly detected cases. And when we take the age group cohorts, between 20 to 49, 37% detection is happening, which is a fairly early age group. Between 50 and 69, 46% of the cases are detected, and above 70, the number is smaller, say around 15%. And in case of urban, the recovery rate is 1 out of 22. While in rural areas, 1 out of 60, which indicates that there is a lot of divide between the urban and rural areas. As a public policy practitioner, it is important from the government's point of view that such kind of conferences, after the research and after the input from various delegates who come from various parts of India, and also from the departments of health, Department of Higher Education, and other departments, can give it their inputs to the government to change the public policy wherever it is required. Which is the selected group which we need to work on? Do we need to work on rural areas more or the urban areas more? Another very alarming thing is that the incidence in the Kashmir Valley is much higher than the rest of the country. While we are very good in other parameters, health parameters, we are in fact the third healthiest union territory of state in India in other maternal and child health parameters. But why in this particular parameter we are having high incidence? Is it the dietary factor? Is it the Vazwan? Is it the lack of exercise? Is it the lack of care in terms of the maternal child care? Or is it the socio-cultural factors which prevents the rural women from coming to the health systems? I think on this already Director Skims and Principal GMC has shed light on the factor that they have now put in a lot of female health workers, female doctors, which will improve the number of women coming for detection. But I think what is very critical is that the lifestyle factors, the balanced diet, non-use of alcohol, reduction of smoking, encouragement of breastfeeding, the misuse of HRT, hormone replacement therapy, radiation exposure, which has been raised by Registrar Saab, and in much detail, that how the radiation is utilized beyond what is required. The incidence of the BRCA gene, which also runs through families. I know certain families where almost the grandmother and the next generation and right till the granddaughter, everybody suffered from the incidence. So in such kind of cases, maybe some kind of early intervention can prevent and save lives.